So we'll go ahead and bring the conference committee meeting on House Bill 2094 to order. So we met previously. House Bill 2094 is a shall, and it's the request of the House for the Senate to consider inserting three bills that the House passed this year, 2140, regarding employment and training programs for 50 to 59-year-olds in order to receive food assistance. House Bill 2141, which the Senate did not pass. I think it failed the Senate 2020. And also House Bill 2179 regarding the child care assistance and the time to determine cooperation. Just putting that clarification there that DCF will look at cooperation upon application and upon the 12-month review. And a little history on that. Currently, it's interpreted that as soon as there is no cooperation, benefits are stopped. And that's out of compliance with federal rules. So DCF introduced the bill eliminating all of the cooperation requirements. That our committee on the House side amended it to reinsert the requirements for cooperation, but in order to address the federal compliance issue, we just clarified that cooperation should be determined upon application and upon the annual review, because the feds say once you start benefits, they have to continue for 12 months. That's a quick summary of those three bills. So, Madam Chair.
Thank you, Mr. Chair, and we appreciate the break to have the opportunity to refresh on the bills that we hadn't seen. And I was able to ask my questions of the reviser. I think we all were on committee. And pretty much it looks like on 2179, we just see the change from secretary to conduct the reviews of cooperation, as you mentioned. And then on page 5, that it's a duplication here under the TAMF benefits as to the child care subsidy. And that pretty straightforward. So I believe that our discussion was that we would not have an issue with including 2179 into the shell that you mentioned. So if we take these one at a time, if that's all right. Also on your offer, you had mentioned 2140. In looking at 2140, it's just, as you said, basically changing the difference from the ABOD or able-bodied adults, the 18 to 49. And I asked Reviser why it is that was stricken and not just made 59. And then I was told that the federal definition for able-bodied adults only went up to 49. So in order to include the 50 to 59-year-olds without dependents, it needed to have its own line item. Is that how you understand it?
Yes, Madam Chair. We spent a lot of time on just understanding the definition, but at the federal level, they allow states to add employment and training requirements in order to receive food assistance for what's called a work registrant. And there's a lot of exemptions. One is the group of ABODs, which is up to 49. They have their own set of basic rules, and then people between 16 and 18 and 50 and 59 have a different set of rules, but essentially all of those are able-bodied adults without dependents, just by a different name. So that's why it had to be called referred to as work registrants as opposed to ABODs.
Thank you for that clarification. Also, again, the two of us have agreed to include 2140 into the discussion and into that bill. The one issue that we wanted to talk about was 2141, and that's the third bill. One thing that we found when that was presented on our floor, it passed the committee, but on the floor it did not. It was 20 to 20. And so we're thinking perhaps that might not be, maybe not the right year for us to put that in. I know that it passed on the House side. So we were thinking maybe just these two bills and wondered what your thoughts are.
Madam Chair, if you don't mind, we'll take a quick second. So thank you, Madam Chair. Certainly respect your thoughts on that. And we did put a lot of work into it, especially the amendment to try to get the bill to get out of committee and pass the House floor. But at this time, we'll certainly agree with your proposal to not include 2141 in the bill under discussion. So with that, we're looking at including 2140 and 2179 into the shell 2094.
And the Senate position is we are in agreement.
Thank you, Madam Chair. Discussion.
Thank you, Mr. Chair. I had mentioned previously in committee, I was very concerned about 2140. I think that 2179 is a great bill. It was brought to us by the DCF, and I respect their perspective as an agency. So I don't want to talk about that so much, but 2140 is very concerning to me. I'm not sure if you heard my arguments on the floor against it, but I am a social worker. I've been in the field for many years, over a decade. And through my experience, what I've noticed, and I even shared a story about a client, but I won't go into that here for timeliness. But um, the issue is that with individuals ages 50 to 59 years old, typically the reason that they are not working or unable to work 30 or more hours is because they are not healthy enough to do so. And I found that the majority of my clients in that age range, and those of my colleagues and those that I've worked with through many different fields, and confirmed with individuals who do process applications for the DCF, find that that is true as well. Unfortunately, it takes a really long time for people to apply for disability in order to receive benefits, such as additional SNAP, healthcare benefits, and the like. My position on this is that if we were to extend this, we would need to provide an avenue for them to get healthcare. And because of that, I would say that if you would like for me to support it and to agree with the conference committee report and the bundling, I would appreciate it if we could strike the language requiring Medicaid to be expanded only by an act of the legislature. For me, in my line of work, the way that I see it is that if we want people to truly work, to return to work, to help better their lives, to rely less on state benefits, but they're still low income workers, they really do need this help. And typically they are too unhealthy to work. That is just a fact of serving these individuals in the field. I'm not overstating this in any way whatsoever, and it's not for an agenda. I can approve of this bill and that raising of the age requirement if we do that. I think that it's a simple fix for both issues. And I would really appreciate it if that would be given some consideration. Um, because if we truly want people to get back to work, we have to provide them with a way to do so. And that's what I would appreciate if we could discuss that a little bit.
So I guess real quick, my comments on that. We, ultimately in the conference committee, we take a look at the House position. It's my approach anyway. 2140 passed the House. We did have discussions on this idea for an amendment. It was ruled not germane. And that brings up a whole different conversation as far as Medicaid expansion, kind of a little bit outside of what the intent behind 2140 is. So I just don't think it holds to what the House's position is on 2140. So, Senate Madam Chair.
Thank you so much for that. And I just would say the 50 to 59-year-old group, and by the way, I appreciate your comments being a social worker. In that, what we found when we did the 18 to 49 is we're just asking to either work the 30 hours or be part of a work study program. And I'm just curious, where was your thinking that these people are too ill to be part of a work study program as well?
Yes, actually. So I'm from the Kansas City area. I served a 9 county area. And typically, yes, people were too ill to be working in the volunteer setting. They weren't able to stand for long periods of time. They had heart conditions, diabetes, all untreated, and those lead to major complications. In addition to that, they weren't able to find transportation. They weren't able to access the services needed. And we had previously discussed good cause exemptions. Um, in practice, those don't occur very frequently. It's up to the eligibility worker, and typically, eligibility workers don't hold a degree of my stature. They're typically not quite bachelor's level. So they don't make those decisions with all of the information that they could have at the time, nor fully understanding the impact. To the germaneness, if I may just say, this is one section. All of our public benefits are in one section. This is at the very end of the same section. I, of course, very much disagreed with the ruling. I still do think it's germane, and I do think that this is an avenue to really get people back to work.
And of course, uh, as the representative said, we're not here to debate germaneness of what they determined on the House, but I appreciate your thoughts. And but as you said, there are some working poor that are in the 50 to 59 that are receiving some services that could participate and are not. We would really like them to, and I believe there are some good cause reasons. Probably not the way to say that, but some exceptions for folks who could not participate anyway. I know that there were in the immediate, the original bill with the 18 to 49-year-olds. And with your, I know we have to go to other committees, Mr. Chair. With your permission, we're ready to vote.
Thank you, Madam Chair. I certainly accept your 2140 and 2179 in part of the 2094. I think also Vice Chair as well. So looks like two on this side.
And we have two on this side with one absent.
So is this going to be agree to disagree, or are you willing to help us move this through the process? So we'll have to disagree and then come back after that. So we're back on the House floor at 8.
I do believe that we have an agree to disagree drafted by the reviser.
Address that on the House floor at 8, and then I don't know what the rest of your evening or how late we're going to be here, or whether we'll just wait till then, or. And we'll work on a meeting time later. Is that all right?
It's fine.
There's nothing else. We're adjourned. Thank you.